A healthcare revenue cycle business intelligence analyst is a professional who specializes in analyzing and interpreting financial data related to the healthcare industry. They use advanced analytical tools and techniques to gather and process data from various sources, such as electronic health records, billing systems, and financial reports. Their primary goal is to identify patterns, trends, and opportunities for improvement in the revenue cycle of healthcare organizations. The healthcare revenue cycle process is the series of steps that healthcare organizations go through to manage and collect revenue from patients, insurance companies, and other payers. It includes several key steps, such as scheduling. Patients schedule appointments with healthcare providers. Registration. Patients provide their demographic and insurance information when they arrive at the healthcare facility. Eligibility verification. Staff verifies the patient's insurance coverage and any authorization requirements. Clinical encounters. Patients receive services from healthcare providers, such as office visits, procedures, or treatments. Coding and billing. Staff codes the services provided using the appropriate codes and submits claims to insurance companies and other payers. Payment and collections. Insurance companies and other payers process claims and make payments, and the healthcare facility processes patient payments. Denials management. Staff handles denied claims, appeals, and follows up on unpaid claims. Reporting and analytics. Staff uses data and analytics to track performance and identify opportunities for improvement in the revenue cycle process. The revenue cycle process is a critical process for healthcare organizations as it directly impacts their bottom line. Therefore, healthcare organizations need to have a good understanding of their revenue cycle to identify and address inefficiencies and improve their financial performance. Business intelligence (BI) is the process of using data and analytical tools to gain insights and make informed decisions. In the healthcare industry, BI is used to analyze data from various sources to identify patterns, trends, and opportunities for improvement. A healthcare revenue cycle business intelligence analyst plays a critical role in this process by analyzing data and identifying areas of the revenue cycle that can be improved. The main responsibilities of a healthcare revenue cycle business intelligence analyst include gather and analyze data from various sources, such as electronic health records, billing systems, and financial reports. Identify patterns, trends, and opportunities for improvement in the revenue cycle of healthcare organizations. Work closely with other members of the healthcare team, such as financial managers, billing specialists, and clinical staff, to ensure that the data they collect and analyze is accurate and relevant. Use analytical tools and techniques, such as data mining, statistical analysis, and forecasting, to make recommendations for process improvements and to support the decision-making process of healthcare leaders. Create and maintain detailed reports, dashboards, and other visual aids to communicate their findings to stakeholders in an easy-to-understand format. One of the key responsibilities of a healthcare revenue cycle business intelligence analyst is to analyze data from various sources to identify patterns, trends, and opportunities for improvement. For example, they may analyze data on claims denied by insurance companies to identify common reasons for denial and recommend changes to the claims process to reduce denials. They may also analyze data on patient payments to identify opportunities to improve the billing process and increase collections. Another important responsibility of a healthcare revenue cycle business intelligence analyst is to work closely with other members of the healthcare team. They may collaborate with billing specialists to ensure that claims are coded correctly and submitted in a timely manner. They may also work with financial managers to develop budgets and financial projections. Additionally, they may work with clinical staff to ensure that patient data is accurate and up to date. A healthcare revenue cycle business intelligence analyst also uses analytical tools and techniques to make recommendations for process improvements. For example, they may use data mining to identify patterns in the data that can be used to improve the revenue cycle. They may also use statistical analysis to identify trends and make predictions about future performance. Additionally, they may use forecasting to project future revenue and identify potential risks and opportunities. Another important responsibility of a healthcare revenue cycle business intelligence analyst is to create and maintain detailed reports, dashboards, and other visual aids to communicate their findings to stakeholders in an easy-to-understand format. These reports, dashboards, and visual aids provide insights into the performance of the revenue cycle, identify areas of improvement, and support the decision-making process of healthcare leaders. In conclusion, a healthcare revenue cycle business intelligence analyst plays a critical role in the healthcare industry by analyzing data. To learn more, please visit www.healthcaredatatranslator.com.